Hello, everyone. Welcome back to the Safe Sister Circles Circle Chats. My name is Tian Dillard, and I will be serving as your host for today's session. In honor of Sexual Assault Awareness Month, we have a very special guest, and it is my honor to be able to introduce her today. Her name is Miss Christeen Badie. She's a resident of Washington, D.C., and is the program manager for DC Forensic Nurse Examiners. Since the organization's inception in 2013, DCFNE has been offering free medical forensic exams for survivors of sexual violence and intimate partner violence. It later expanded its services to support adult family violence survivors. Ms. Badie obtained her bachelor's from the University of North Carolina at Charlotte in international business and her master's in social work from Rutgers University. Ms. Badie has ample experience working in case management, program management, and serving survivors. She has witnessed firsthand the intersectionality between health, domestic, and sexual violence. It is a pleasure to have Ms. Christeen Badie with us today for our Circle Chat session. Welcome, Christeen. Thank you so much for taking time out of your day to be able to speak with us about your experience as the program manager at DCFNE.
Thank you so much, Dion. It's a pleasure to be with you today.
So in honor of Sexual Assault Awareness Month, again, it is my greatest pleasure to be able to interview with you today. And the Safe Sister Circle and DCFNE have, very aligned missions. The Safe Sister Circle is a nonprofit organization that provides free, culturally specific, holistic, and trauma-based services to Black women survivors of domestic violence. And DCFNE and the Safe Sister Circle are both community organizations that provide free resources to survivors within the Ward 7 and 8 community. Are you able to share more on how you actually connected with the Safe Sister Circle?
Yes, absolutely. Safe Sister Circle current staff, attorney Tamaya, and I collaborated at her previous role with another organization. And when she began working at Safe Sister Circle, she reached out to me to ask if we can collaborate again. And DCFNE is excited to work closely with community partners to provide holistic services for survivors. So we always welcome the opportunity for continued collaborations and partnerships.
So thank you for providing that. Again, I am very excited to see how the Safe Sister Circle and DCFNE are able to partner going forward. And specifically speaking about DCFNE, can you talk more about how the organization actually offers its services to survivors?
Sure, all of our medical forensic services are free to survivors of sexual assault and domestic violence. We conduct sexual assault exams 24/7, 365 days at MedStar Washington Hospital Center's emergency department. We have a suite there specifically for forensic exams where we see patients. And for those experiencing domestic violence, like violence by an adult family member or a current or former intimate partner, exams are available for them at MedStar Washington Hospital Center anytime as well. But we also offer multiple community sites where they can receive an exam. So for example, we have a DCFNE clinic in Tacoma neighborhood in DC. We can also conduct on-site exams at My Sister's Place shelter. And even though we're still dealing with COVID-19, we continue to respond at the hospital and in community settings with safety protocols in place. And most recently, we established a partnership with you all at Safe Sister Circle so we can provide on-site exams at your office to best serve survivors in wards 7 and 8. And community site exams are available by appointment only.
Well, thank you so much for providing those details into, again, how they are able to receive your services and most importantly, how they are able to continue to get your support throughout different locations. So could you provide more insight into how the nurses are trained to provide forensic services at DCFNE?
Absolutely. They receive extensive trainings. So, for example, in order for a nurse to qualify as a forensic nurse and to work with us at DCFNE, they need to first be a registered nurse and have at least 2 years of nursing experience. And that could be in a variety of different settings. So they must first participate in an approved 40-hour sexual assault nurse examiner course, short for SANE course, which covers a variety of information related to their role, such as trauma informed care, understanding the dynamics of interpersonal violence and sexual assault, the legal system, and of course, medical considerations. And following the course, they need clinical experience, which we provide to those we train through our own 40-hour SANE course and to those we hire as forensic nurses with DCFNE. We also ensure that our nurses are staying on top of the latest evidence-based practice by providing ongoing education. Forensic nurses at DCFNE are specially trained to serve survivors of violence, so survivors can rest assured that they will be well taken care of when they see our highly qualified team.
I think that's fantastic to know that, the nurses that you are able to train are actually or can be trained on site. And I think that that definitely probably provides a more comfort level with the survivors that you do serve. And, DCFNE's mission, again, with our partnership as well, is aligned with the Safe Sister Circle. Our organization applies women of colors, racial and gender specific, kind of responsive lens to directly guide the decisions of the organization, its programs, procedures, and outreach initiatives. And so I was curious, how does DCFNE as an organization embody its mission and work towards providing trauma-informed holistic care to survivors?
So, in addition to the in depth training that we just spoke about with our nursing staff, we provide that training to make sure that they are providing high quality, patient centered, compassionate care. But in addition to that, we also pride ourselves on working collaboratively with medical providers, universities, and victim service providers to ensure that patients are connected to ongoing advocacy and case management services, and of course, follow up medical care to support their ongoing needs and healing process. We especially cannot do this work without our advocacy partners and many of our community partners.
It's great that all of the organizations within the Washington D.C. community are able to support each other in one way or another. So that's wonderful news. As you may know, April is Sexual Assault Awareness Month, and could you elaborate on the benefit of having events that reach and support survivors?
Sure. So, the goal of Sexual Assault Awareness Month, or SAM for short, is to bring awareness through education about consent, sexual assault, and available community resources. DC has a robust network of sexual assault service providers who host several events in SAM and beyond. I encourage folks watching to check out the DC Coalition to End Sexual Violence website at dccesv.org, where they will find the calendar of SAM events. Community events and online social media campaigns are an excellent opportunity for community members to learn more about the issue and educate themselves on available resources.
So that's fantastic. And I kind of want to shift gears a little bit as well, where, with your ample experience in the field, have you learned anything from survivors that have obtained DCFNE services?
So, since our inception in 2013, we have learned that every survivor is different. People react differently to the trauma that they've experienced and have various needs and priorities when it comes to seeking care after an assault. So, our approach to caring for survivors is patient centered, which means that the patient gets to drive the entire process and to choose exactly what they want. It is the job of the DCFNE forensic nurses to identify the patient's needs and to meet them where they are.
I think that that is absolutely remarkable, and I really appreciate your response there. It goes to show that again, it doesn't just stop at the actual exams and those types of services, but it goes beyond that to make sure that the survivor is aware of the resources available to them. And so, as we are kind of wrapping up the interview here, I know that you mentioned, different community providers that are able to provide certain events through the month of April. Are there any specific events that DCFNE has hosted in the past or maybe hosting soon?
Yes, so last year we hosted a virtual screening event of one episode of the mini series called Unbelievable. It's on Netflix. And after the screening, we held the panel discussion with several organizations and a sexual assault survivor who discussed seeking support and available services. And additionally, every year we participate in the National Sexual Assault Resource Center's social media campaign. And during that campaign, there are daily prompts that help to educate the community about sexual violence. We will be participating again this year starting April 1st and throughout the month of April. So we encourage folks to follow our social media handles to learn more about events happening, to learn more about DCFNE and other resources as well. So we can be found on Twitter, Facebook, and Instagram at DCFNE.
Well, fantastic. So, is there any additional advice you would like to leave with our audience who may be interested in learning more about your organization?
Yes, it's critical for survivors to know that we are accessible, we are here, our services are free and confidential. Our exams are 100% driven by the survivor. They can choose any or all portions of the exam. Survivors do not have to report to police. Even if a survivor does not want to report to police and does not want evidence collection, the medical forensic exams are still beneficial for the health and well-being of the survivor. So when they seek our services, they will receive services from highly trained medical professionals who understand violence, and they will receive the proper care, treatment, and medications they need to prevent infections like HIV and sexually transmitted diseases and to prevent pregnancy, and ongoing support from advocates during and after the exam as well. I also want to make sure that everyone knows that we serve any patient, regardless of sex, gender, language ability, immigration status, and income.
Thank you so much. I really do commend you for, the work that you do for the organization, that the work that the organization does for the Washington, D.C. community and beyond. And it's really been a pleasure being able to speak with you about your services today. One last question, for those who may be interested, and you kind of already mentioned the social media accounts that DCFNE has, how can those interested in obtaining DCFNE services reach out to you?
We have more information about our services, including videos of our space at the hospital, and that can be found at dcfne.org. And anyone interested in obtaining a medical forensic exam, whether for the hospital or on a community site, or just has any questions, could reach out to us through the DC Victim Hotline, which is 1-844-443-5732.
Well, thank you so much again, Christine. It's really been a pleasure having you here on the Safe Sister Circle Chat session today. And again, thank you so much for providing that information. I really do think that our viewers will be able to spread the word for those who may be interested in your services or at least being able to collaborate with the organization. So thank you so much for all of your time today.
Thank you so much, Dion. It was a pleasure to be with you today, and I am looking forward to our continued partnership.
So thank you everyone for tuning in for another Circle Chat session with the Safe Sister Circle. It is always my greatest pleasure to be able to interview with these wonderful, powerful women who are not only supporting wonderful community organizations, but doing awesome work to support domestic violence and sexual assault violence survivors in the community. We truly appreciate all of your support. Please continue to donate and remember to follow us on all of our social media platforms. So until next time, take care.